Good morning, everyone. I'm just kicking it off and turning it over to Councilmember Cathcart. Councilmember Kinnear is unavailable. So go ahead, Councilmember Cathcart.
Thank you, Council President. All right, well, we can just get into it. Is there a motion to approve the minutes from last month?
Move.
And a second?
Second.
Okay, moved and seconded. Any discussion? All right, all those in favor say aye.
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 And opposed? And abstaining. Okay. I haven't had any requests for anything to come off of consent. Not hearing anything at this point. We will go straight to our first agenda item, which is Mike Ormsby discussing the mental health crisis stabilization facility.
Thank you, Councilman Cathcart and other members of the council. You've received a lot of background in the past about the mental health crisis stabilization facility, and I know time is short. Specifically today, we're talking about additional contributions by the city and the county in order to enable the facility to be constructed. As you all know, and if you just look at attachment A to the proposed agreement, we have received close to $7 million in grants from various state and True Blood sources. In addition to that, the county has pledged additional mental health tax money, REIT support money, general fund money for a total of about $1.5 million. And the request is that the city of Spokane contribute up to $1.1 million to make up the delta between the low bid that was received for construction of this facility and the amount of grant funds we have. Couple of things at play here. The first is for every month that we don't commence construction and therefore complete the facility, we're going to lose up to $200,000 in grant funding, which would make the project even more difficult to construct. And I think in the past, Arian and Council President Beggs have briefed the council on the importance of this particular facility to the criminal justice reforms that the city and county are trying to do. And instead of continuing to discuss how we're going to come up with the money, I think both the city and county leadership said, we ought to just come up with the money and get going with the construction of the facility. And so the ask today would be to improve the approve, maybe it can be improved as well, but approve the proposed interlocal agreement between the city and the county to go forward. I think you all received an email from Arian, the project manager on this particular project, and ground was broken, or there was a groundbreaking ceremony. I think ground was broken sooner, but a groundbreaking ceremony that Council President, the mayor, and others participated in last Friday. So we're proposing, and I think it's proposed to maybe be added under a suspension of the rules this afternoon, that this agreement be considered and approved by the council. I'd be happy to answer any questions that any council members may have. I don't know, Council President Beggs, if you wanted to add anything. This has kind of been a project you have spearheaded for a long time.
I'll just speak briefly to it. It's really exciting. It'll be a one of its kind in the state, but it's based on components of very successful programs. The essential cost savings for us is, as you know, when someone goes into the jail and the city's paying for it, we pay over $130 a night. Plus, the county has to pick up all their medical and mental health expenses because a person's ineligible for Medicaid reimbursement of their treatment while they're in jail. This facility is not a jail. The people who go to it only go to it if they have charges in a category the prosecutor's office has already approved, and the law enforcement officer who has arrested them believes they would benefit more from stabilization and treatment than going straight to the jail, and the person agrees to go. But the benefit is that when they go there, the vast majority of the cost of treating them and housing them is picked up by Medicaid. And then also the evidence is that when people go there for the right kinds of charges and situations, they're much less likely to commit future crimes and less often, and they tend to get out of the facility in a few days into a stable situation instead of staying in the jail usually for someone suffering from mental health issues. It's about 26 days or longer. A lot of people stay longer. So it saves us a lot of money, and the contribution on the capital is fairly modest compared to the money we've gotten. And just as a reminder, for those who haven't been on the council as long, we, the city council, several years ago, I think 4 years ago, made this our top priority to get funding from the legislature to build this, even though it was for the county, and we were successful, and the county has picked up that baton and gotten even more money. So it's mostly funded by the legislature.
So do we know, and maybe when Mum has an answer to this, do we know exactly how this will impact our current budget? I assume this would come out of reserves.
I don't know what the source of the funds are. Councilmember Beggs, do you know if this is sourced?
I don't know, but we'll find out before 3:30. My presumption it comes out of reserves, but I'm not positive on that, whether or not there's another identified. But we'll find that out before we talk about it. It would likely, if it comes even close to what the prediction is, it will save us net money that would otherwise have to come out of reserves in operations.
Yeah, I think this is a really important project, obviously, to get done. I just want some more info on the financial side. Okay, any other questions, comments? Okay, well, so we will move on from this topic, and we will go to Sergeant Spearing with an update on criminal justice reform.
And I'm here. I'll let you see my spent the weekend fishing beard. I don't have to work till tonight, so hopefully the chief cuts me some slack. So for the month of September, we had 67 deployments of our patrol canines. 40 of those were captures. 0 bites for the month of September again. Training-wise, again, it breaks down the same as it did before. Apprehension was 28% of what we trained on. Building search, 27%. Tracking, 15%. So those were our top 3. We had a contact on Thursday, so the very 1st of October. So I'll brief that with you next month since it falls into October. For September, 2 deployments that stood out substantially. One was a first-degree robbery warrant, and the other one was fresh first-degree robbery. So on the warrant, Haywire is the canine and Officer Stone tracked from 30th and Cook. It was a great example of Officer Stone watching Haywire's nose to the ground, following human scent on a track, leading him past several open areas that it looked like somebody would have run and would have been the natural place to go. Relying on the dog, getting towards a dumpster, and then seeing Haywire's nose come off the ground and start air scenting, which is an indication that somebody is in that area. Pulling the dog back, giving verbal challenges to the dumpster, and seeing 2 sets of hands come popping out. It was the bad guy we were looking for, and it was somebody else who was hangs out behind the dumpster on a regular basis and was helping hide the bad guy, but hadn't done anything wrong. So it's a great example of being able to find our guy, but not contact anybody. And the second one, Zeus, the same thing, followed a track to a apartment complex near 2nd and Thor, and working around that complex, actually alerted on the door to one of the apartments in the complex, like we train the dogs to do when they can't get at somebody. He started barking at the door. Officers were able to put a perimeter just on that apartment, make announcements, and our bad guy came out and was taken to jail, first-degree robbery. So a couple good examples, and like always, I'll keep this super short. Take any questions you have.
Any questions for Sergeant Spearing? Okay, seeing none, we will move on to, thank you. We'll move on to staff requests.
Councilmember Cathcart?
Yes.
Hi. I just wanted to tell you that Tanya Wallace and I have been texting. We have an answer for you. The money was not coming out of reserves. It's coming from the balance of the Criminal Justice Fund, which right now has $7 to $9 million in it.
Oh, okay. No, that's a good update. Thank you very much. Okay, so staff request DUI court grant extension. Seth Hackenberg.
Hi, good afternoon, everyone. My name's Seth Hacker. I'm the coordinator with the Therapeutic Courts. I'm here today on behalf of DUI Court and Community Court. With me with DUI Court is Judge Tracy Staub and Hans Forsyther of probation. We just want to give you an update on an extension to our grant from the Washington Traffic Safety Commission. It was totaling $63,000. And I'll pass it off to Judge Staub and kind of give more grants on that.
Go ahead, Judge. Oh, can't hear you.
There we go.
There we go.
All these new systems now. So, hi everybody. It's good to see you all, even if you look like Hollywood Squares. So, as Seth mentioned, we got a grant extension from Washington Traffic Safety Commission, and we're super excited. This is not something we even asked for. It's something that they have given to us again. So we're in our third year. We're finishing up our third year of DUI court. I will tell you that we have not had one participant reoffend with another DUI, and these are people who have multiple DUIs, who are dealing with mental health issues, who are dealing with substance use disorder. So it just kind of shows that this high level of supervision and this hands-on approach to people who are high risk, high needs really does work. We're making, I mean, that's why we're getting this grant, is because they're so proud of what we're doing. So we're really excited. The grant breaks down to the bulk of it is for UA testing. Every person that enters the program has to have up to eight random UAs a month, and that's in addition to the alcohol monitor that sits on their legs, so they're getting tested like crazy. And that goes on for quite a while until they start to phase up, and then we start to reduce those numbers towards the end. But we test everybody through the entire program because that's what best practices shows works the best. So a significant amount of the funds we receive is for random UA testing throughout the program, which can last anywhere from 18 months is the fastest you can get out of it to 5 years. We just let people set their own pace and decide how quickly they want to go through this. Another $12,000 is set aside for traveling. We were supposed to go to the NADCP National, is it something, drug court, the drug court program. They put on training every year. We've been going every other year. We were supposed to go this year down to San Diego. COVID hit. Everything got canceled. So next year, the team is hoping to go to Washington, D.C., I believe, and hit that conference next year because we get some really good training for that. And so we have some funds set aside from this grant to go do that. We have a small chunk of the funds from this grant, about $1,000 that we're going to use to buy tablets. Almost immediately when the lockdown occurred, we recognized that our entire program is based upon constant and frequent contact. So I think within a month we had gone to complete Zoom hearings, and we've been holding court by Zoom ever since then. So I think in April is when we started, and actually the participants really like it because it's much less time, much less disruptive out of their days. And so we've told them, as long as you continue to participate and this continues to work, we'll go down this road. But if people disrespect it or don't treat it like a real court hearing, then we're going to go back to in live. But so far, so good. We have had a couple of people who broke their phone or had issues with tablets, and that'll help people participate by Zoom. And some a little bit set aside for day planners and bus passes. I'll tell you all that when the first of the year rolls around and Walmart puts their day planners on sale, I clean out the shelves. They can usually get them for like 50 cents a planner or something like that, and I hand them out to everybody who wants one, DUI court or participant or whatever. So if you're in Walmart and you see day planners on clearance, grab them because I can always use them. So, but that should give you the general rundown on this new grant. We're really excited. We're very appreciative for Washington Traffic Safety, and we, if you have any questions, please let us know.
Any questions for them? Okay, we've also got a second portion here for Seth on the expansion of community court. Seth, you want to take that away?
Yes, good afternoon again, everyone. Also here on behalf of Community Court. We were awarded a grant from the BJA totaling $166,000 or $166,048. My mistake, sorry. And I'll go ahead and pass it off to Judge Logan. He's with us as well. Give us a little bit more information about that.
Hi, good afternoon. Yes, so likewise, as Judge Staub was proud to be a recipient, as are we. We pursued ours, however, and it was under the auspices of BJA, and it's an enhancement. The program was to either create or enhance a community court project in the city of Spokane, and it was to have case management, supervision for treatment services and or provision of and coordination of recovery and support services. So a component of our grant, about $88,000, is for a 2-year time period. We're organizing a small group of individuals from East Central to be the group that hires what we hope to be our service provider coordinator, whose sole job really is when individuals are cited in to get them then connected to services, everything from employment services, identification services, any of the wraparound services that community court is already engaged in. A component of our grant is also for education purposes, and that is of the court itself. Likewise, we were granted travel funds. Whether or not that actually becomes something that we can engage in depends, of course, on COVID and the openness of the educators for that. Another component of education, $15,000, is set aside for the Just Lead program. They will be providing us with continuing education involving bias and implicit bias. I know that the city right now, the prosecutors, defense, and the municipal court is undergoing some training in that regard. But this is also to make sure that we are absolutely on the top of our game and having that sensitivity and comprehension of the population that we will be serving. I'm certainly open to respond to any questions that anyone may have. We had our first session today, and as is often the case for these, when you first open up, this instance we had one individual that was set on the docket. He did not show, so we are hoping to see him in a couple weeks again. But we had lunches available. We had service providers that were there, and then otherwise that would have been on call, or again, we also use tablets so they can have that face-to-face contact. But we didn't have anybody to serve today, and we're hoping, of course, that changes over time. We know that we had that experience with downtown where we went from 5 to 20 to 80 to where we were before COVID hit. And as things relax in the medical world, then hopefully we'll have more eye-to-eye contact. So I'm happy to answer any questions.
Any questions from anybody? Council President?
Councilmember Cathcart, Councilmember Wilkerson here. And where is community court being held at in East Central, Judge Logan?
At the Martin Luther King Center.
So you've heard my concerns around that location. After the presentation last week regarding the Envision Center and all the services that are offered there, why did you guys look at a separate location instead of building on what was already existing and putting it there? Also, in your briefing paper, I guess I just personally had challenges with poverty alleviation in just East Central. That is a huge footprint, and just to identify a whole neighborhood as poverty alleviation is disconcerting to the folks who live down there. One of them would be me. So I just want to look at, you also said you gain commitments from a variety of neighborhoods. I'd like to know exactly who those commitments are going forward. I have not heard from them, and if that's certainly the case, would love to partner with them. But at this point, it has not been a very good communication process from where I sit at City Hall.
Well, let me start with the Envision Center. We had talked to Tim Sigler at the Envision Center. We also, initially there was going to be room for community court, but that was probably over a year ago. Then it filled up because of other work that the Envision Center has taken on. And then I was also made aware, at least my court administrator made me aware, that the lease for the Envision Center was not being extended. So that would not have been a good place for us to begin a court. So that was the sum total of what happened with the Envision Center. We were in communication, then space filled up, and then we became aware that the lease for the Envision Center was not being renewed. So that was the last information as we were planning this, and so we did indeed have to commit. I appreciate your concerns about, I've written notes here, so I appreciate your concerns about the poverty alleviation as a label, and which is why I specifically, when I mentioned about what the group would be that was going to hire, it's really going to be for, we've changed the name, although one of the components certainly is the engagement with reference to employment and education that would lead to employment, or at least getting them to resources. And so a social service navigator is really what we would hope to rename that to, and the flavor of it, because it isn't simply about alleviating poverty. What we have learned in our study of where we would expand our community court is based upon analysis of those communities. And frankly, East Central was really going to be our second expansion, but due to some conflicting space availability and wanting to head off in a different path, we ended up at Northeast instead. But had always been a component of where we thought we would go next, and that was by sitting down at the board that runs the center. We had undergone a presentation with them, and they very much wanted us to be there, and were very disappointed when they were not selected at our second expansion site, as our second expansion site. So when this opportunity that came through with the BJA for an enhancement grant, we pursued it with the idea being that we would probably end up at East Central. And so we revisited that same conversation, not only with the center and the board, who were delighted that we were revisiting them as that location, but we also got support from the East Sprague Business Association. We sat down and had a conversation with them. Also delighted that we would be coming to East Central. We also had a conversation with the neighborhood resources, and also delighted that we were coming with them. One of the other preliminary steps that we took before starting was we had flyers passed out all surrounding around East Central, talking about that this is a location, our coordinator's number and email was provided, and that was passed out by Captain Tracy Meidel, who was also in the neighborhood, and is in the neighborhood, of course, available and open to talk to anybody about that. We didn't receive any pushback based upon that information either. So it was through the course of those steps that the decision was then made that MLK was where we were going to go. I didn't really understand the question about the variety of neighborhoods. I must have missed them.
Well, I think you mentioned some of them. I will just comment that the East Sprague Business District is on the other side of the freeway, and that group, to my knowledge, maybe some, do not actually live in the neighborhood. I would hazard a guess that probably most of the people on the board, the MLK Center, does not live in the neighborhood. So you have people making decisions about a neighborhood that do not actually live there. And that has been my concern. And I knew about the flyers that went out in the neighborhood, but I live in a neighborhood and I didn't get one. So the neighborhood is talking about not getting rid of policing. That is not the issue. But we always hear poverty alleviation and we never hear economic development. And that's the challenge of East Central. So I don't know what the long-term commitment is for community court is at East Central, or where that lands. I know that's the purview of that building, but I just want you to know the neighborhood is challenged, and I think community court would do well to engage with others and look at other opportunities going forward, because we continue to deal with a stigma put on us by others of a poverty alleviation neighborhood. And so, again, diversion is great. It's a part of the criminal justice system that serves all of us well. But I think there are some challenges and some, gosh, I gotta say, it sounds like a little systemic racism to me. But that's me. That's kind of my feelings going forward on community court.
Thank you, Councilman Wilkerson. I know we're a little short on time, but I want to make sure we get to others. I will just add that I share many of your similar concerns. Council President, I know you had your hand up.
Yes, I had two questions for you, Judge Logan. They're not particularly related, but I'll just say them both so you can answer them. One is on the Just Lead training. When your personnel are going through it, if there's more capacity in terms of seats in the room available, council would love to know about that. I attended a year-long training with their predecessor organization and found it effective. And so if we're spending money with resources we have, the more people, the better. So that's one. The second thing, I'm just wondering if you could tell us a little bit about how the downtown community court works in terms of all these agencies that appear on community court day, how many people they serve that are actually in the purview of the court versus how many people are they just serving who are from the surrounding area. If you could talk about that resource that will then be at the MLK Center once a week.
Thank you. Certainly, if there's capacity for the Just Lead, we'll open it up as wide and far as we possibly can, because again, I find the high value in what they have, what I have been exposed to so far. As to, and this isn't just for downtown, it's any of the community courts, the access to those providers is not directly required to be criminal justice, down the criminal justice conduit. What I mean by that is, if the doors are wide open, these are public facilities, and what we have found, and we do this at both locations, the question when somebody comes to the front door is, are you there because you've got a ticket, or are you there because you're accessing services? And what we have found is for downtown, again, when things are wide open, it was 1-for-1. So if we had a head count of 1,500, which I think is actually roughly a number we've had, we would have likewise 1,500 non-criminal justice involved individuals who were there just accessing services. And that would be true, and that's true for Northeast, wherever we are. This is services that's available to anybody who is needing some assistance or help. And again, I want to assure Councilwoman Wilkerson about the poverty alleviation component. While it is a component of what we will be doing, it is not the highlight or the heyday of why community court is there in particular. Again, studies have shown us that yes, there certainly is need for some assistance, but our hope is that we are there to also bolster that which East Central is hoping for and seeing in some of the very positive projects that have happened, like the Perry Street District. That's wonderful what's happened there. And we will be gathering data to make sure that ours is a positive influence there. Certainly not trying to bolster systemic racism, which I think I heard you say. That's not a part of what we are at all, which again, why it's so important that Just Lead program is a part of what we are doing and what the training that we are all undergoing and then providing to those that can participate.
Councilman Burke.
Thank you. And judges and Seth, thank you so much for joining our meeting. I just wanted to commend all of your effort in this. I think everything you're doing is really, a cutting edge. Not a lot of other communities have these type of programs, and it's saving our community dollars by diverting people away from jail. And I know I visited both community courts, the one at the library and the one at Northeast, and I think that they are a great thing for the neighborhood. Speaking specifically for Hilliard and Bemis, we talk a lot about how do we get resources to people? How do we meet people where they're at? And this is just a great prime example of really serving people who might not have everything they need to be successful. And I love having it in our neighborhood, and I think East Central is a perfect location. I hope that we can get it in West Central at another community center. And what a great utilization of our buildings and our communities and everything. So I just want to commend you guys for really trudging and pressing forward on this, because it's so innovative, and other communities are going to follow what we're doing. So thank you all.
Thank you.
Okay, any other questions? All right, seeing none. Thank you guys very much for your
Thank you.
sharing today. We will move on to council requests. And I've got first Councilmember Stratton discussing community policing.
Thank you, Councilmember Cathcart. I invited Patrick Stryker to provide some information today regarding all of the activities that the COPS program has been involved with. Primarily, I'm so impressed with the COVID response, and I want council members to be familiar with some of the activities they're doing, because they might be helpful in your neighborhoods as you hear from folks that might need some resources or some help. I sit on the board of COPS, and we hadn't met for a couple months because of COVID, and our last meeting was just great getting those updates, and I was absolutely so proud of this group and what they've been able to do. So I'm going to turn it over to Patrick Stryker. He's the director, and he's going to give us a kind of an overview of what COPS does and some of the really unique activities they've been involved in the last few months. Patrick?
Thank you, Councilmember Stratton. Can you guys hear me okay? You see me okay? All right, good. So I'm sitting here with two of my staff, trying to be socially distanced as much as we can. Gosh, since the COVID stuff, we've worked so hard to stay busy. I know a lot of groups have, others have tried to take it easy, whatever. We have pushed forward hard. Once COVID came and we kind of went into lockdown and knowing, okay, well, if we can't have the cop shops open to be there for the community, if our business model has to change temporarily, how can we be there for the community? And maybe that's going to look a little different. And so we created a program that knowing that people are on lockdown and can't get out, not everyone has a social support network to be able to get food and supplies and medical things, whatever they might need, prescriptions. And we thought, well, since our volunteers are going out on patrol and they're already driving around town, couldn't we reach out to people that maybe were homebound and didn't have those social networks? And so we did, and that was a great program, got us some good news coverage. Wasn't crime prevention related, but I thought it was a great way to just take care of this community during a kind of a time of crisis. And so Sandy, our program manager, kind of grabbed the bull by the horns on that one and really got our volunteers together. And boy, for several months there, daily, we had calls and emails from mainly senior citizens that were shut in and just needed help to go get some, food or prescriptions, whatever. And so we did that. And that was, I think, a really, really good thing and a great way to take care of this community. And then once we kind of hit phase 2 there and the weather warmed up a little bit, then some of our outdoor programs were able to come back online. Paws on Patrol has been such a great program for us. That was huge this summer. We just had, we were on the cover of, I think it was a Vista, the newsletter, and that got us a lot of volunteers. And that program is really going strong. As with everything we do, it's crime prevention, but doing it in ways that are positive and build community. And so Paws on Patrol is exactly that. And that's just been so great. And so we've been out and about all summer getting into some maybe areas that are experiencing some problems. Obviously, for our volunteers, nobody's armed, nobody's making arrests, nobody's being confrontational, just there to have a presence, observe and report. We have a lot of good, friendly conversations with people, and really just having a presence there and chatting people up. And that's just such a great thing. Kind of crime prevention, I think, at its best, in building community. And so a lot of new volunteers for that. Our mounted patrol during the springtime, when things were shut down, we actually took our horses to quite a number of nursing homes. Since some of the senior citizens hadn't been able to get out for weeks or months, and were going a little bit stir crazy, we were able to grab some horses, show up at these nursing homes, and outside the building, go from window to window to window with the horses, and let the residents see the horses up close, but through the screen of their window. Boy, that was a great way to give back to our community and just help some shut-ins there, again, during that time. And then once things opened up a little bit, our mounted patrol was out in the parks. They were on the cover of the Spokesman back a few weeks ago, the Sunday paper. And that's just another great program to get people talking, get them talking about crime prevention, getting people to own their spaces, get out into parks. When parks and other places are abandoned, then you tend to get a lot of activity that we don't want going in there. But when community members come in and own that space, then it's just a natural crime deterrent. So it's a really, really great program there, of course, doing great things with that. We also started during this time the off-road patrol, because who are we kidding? I just wanted to screw around on ATVs. But it was actually really good because it's a good program to get out there into some of the areas, those rural parks like Palisades, Highbridge, Peoples, that are way back there and hidden and off the beaten path and not easily accessible, and getting back in there and turning those into really positive experiences. We ran into a lot of folks down on their luck. We always brought food and water with us, handing them out to people, garbage bags, helping people clean things up if they needed it. A few weeks ago, we, I think, saved someone's life. He was having a mental health crisis, was way off the beaten path, and it was us that found him. We called 911, got him some assistance, and it turns out the fire trucks and ambulance couldn't even get into the park, so we were able to let them in through the gate, get them where we needed to go. We got him to the hospital and got him some assistance, and I think that's a great thing to get out there, and anything we can do to be positive. And sadly, seeing a lot of drug deals and stuff in some of the trailheads, a lot of stuff going on, but just having the presence there also acts as a natural deterrent so that people can enjoy the parks and keep things positive. One of the great things we've got going is our OCVA program, which has two people, Tamara and Tracy Ponto. And I'd like Tamara to say a few words about some of the great things they've got going.
Hi, I'm Tamara Brannon. I'm a crime victim advocate. My position is funded through the state, through the Office of Crime Victim Advocacy. This year, and especially through the COVID time, has been very challenging with the mental health crisis that has gone along with everybody being shut in. We actually have seen a rise in our direct services, 217% over this time last year. Our unit works directly with our behavioral health unit of the Spokane Police Department, and the majority of our referrals come in from the Spokane Police Department. Dramatic rise in domestic violence, child abuse, and sadly suicide, with Spokane being one of the highest in youth suicide currently. So it has been busy, but we fortunately have an amazing team with everybody working together and cohesively between Frontier Behavioral Health, the Spokane Police Department, and then Crime Victim Advocacy, and then also being able to go and fulfill protection orders and testify in court and go and put together the entire package. We also are very fortunate that our programs are coming together and things have fallen in place, that we are going to be opening our own victim advocacy center and location in West Central, where we are now going to be able to offer our services in a neighborhood that desperately needs it. We are so excited, and that will be along with the launch of the new program that we have called RAISE, which is Release All Insecurities and Stand Empowered, which will be our self-defense program, which will be trauma-centric, which we're very, very excited about. And it's a program that we've been working with along with SPD to work with people who have experienced trauma, teaching them how to, again, release their insecurities and stand empowered, and situational awareness. So we are doing some really good things in the land of victim advocacy. Oh, they're talking around me. It's been a hard couple months, but we are dedicated. We have an amazing team, and Spokane has some great resources. We work very closely with Lutheran Services. We work very closely with the YWCA. It's amazing how Spokane comes together to really, really help the people here, and we're excited to be part of that team and continue moving forward to grow Spokane stronger.
Yeah, during these past few months, we've just tried to get creative and keep pushing forward. My favorite part of my job is the community events that we do and the public speaking. I love getting out into the community. I love talking to people and chatting them up. So these past 6 months have been absolutely miserable for me because we haven't had all these fun things that I love to do. And so we've just had to get creative to make it work. But during this time, our volunteer base has actually grown quite a bit. Our volunteer hours are up, which surprises me. But I think we've just done a bang-up job of trying to get creative and keep to our mantra of fighting crime, but doing it in positive ways that always build community. And I think we're doing a great job at it. Any questions? I have no sense of time. So I don't know if I'm at my 10 minutes yet. But Karen.
I just wanted, Patrick, can you mention the office move to Ash?
Yeah, so Tamara, as you may or may not know, owns Outlaw Woman, which is a great store for building a lot of things. And so now that we stole her from that, she's giving us that location to be able to operate right there on Ash and Nora. That's actually 2 buildings. And so we'll have our main office there. And then right next to it will be the Victim Service Center that Tamara was just talking about. So a lot more visibility being on those main streets there. Right now, our main office, which is where we are right now, is great, but it's kind of hidden and way, way, way up on the north side, a little bit out of the way. So this new location will be a lot more visible and a lot more central to the city, which we're pretty excited about, and a lot more square footage. We've grown a lot in the past 5 years, and so when we moved into this location, it was a little bit of a tight fit 5 years ago. Now, you can't see because of the camera, but my office is full of just stuff for our programs, and we just desperately need more space, which is a good problem to have.
Any other questions? All right, seeing none. Well, thank you so much, Patrick. Really appreciate all that you're continuing to do.
No, thank you guys for all your support. We love what we do, and I think we accomplish a lot of good and do it in good ones. So thank you all so much.
Thank you. Okay, we'll move on to the next item here. It looks like it's an update on the Intake and Release Center from the Council President.
Yes, and I did request it, but I believe we have Maggie Yates to talk with us. This is an exciting program that the county is going to undertake outside the jail, and will have some alleviation on our officers who right now spend a lot of time in their patrol cars with someone in the back waiting for a very inadequate booking center to be available for them. And then oftentimes the people are simply released anyway. So this idea will get our officers back on the street a lot more quickly and hopefully get people who have been arrested in front of a judicial officer at almost all hours, so that they actually get some accountability and there's a quality decision made about whether or not they belong in the jail. But I'll turn it over to Maggie Yates.
Great. Thanks, Council President Beggs, and thanks for the invitation to be here. Can everyone hear me okay? Okay, wonderful. Thank you. And also a nod if you can see my screen with the PowerPoint. All right, wonderful. So as Council President described, the county is working on a new project, and I also shared some information with the Mayor's administration about this recently, and excited to share it with the Council as well. Today, I'm just going to sort of give you an overview of what the model will ultimately look like, and then sort of an update on the current status, some of the complexities related to the model, and then our next steps. So feel free to stop me along the way with questions, but I'm going to move over some information fairly quickly just to get you all up to speed with what we're working on. The model of the intake and releasing facility really grows out of previous conversations that have occurred in lots of different forums over decades about community corrections or a tiered approach to incarceration. There's references to it in the Blueprint for Reform. The Justice Task Force also recently recommended something like the intake and releasing facility. We just have struggled to sort of put structure around the recommendation, and so that's what we're doing here with the intake and releasing facility. And it is intended to do several things. One, it's funded with CARES relief dollars, and so there's a lot of public health benefits with this arrangement. As you all know, our booking area in the current jail facility was not built for the volume that it handles. And so there's a lot of public health concerns around how many people are in there. It doesn't really allow for social distancing, et cetera. Importantly, it is also going to increase efficiency. So because the booking area is so small and a lot of people are coming through, booking times are long and get delayed, which of course then delays officers from coming in and going out. And this model, again, as Council President Beggs mentioned, is going to help increase efficiency, get patrol officers in and out faster, and get those bookings happening quicker as well. And then finally, and very importantly, it's going to increase stability for the individual by connecting them with an opportunity for referral and services. So we all know that even brief stays in jail can be incredibly destabilizing for individuals, interrupting childcare, economic stability, treatment, et cetera. And so we're attempting to try and alleviate some of those factors that lead to instability. The first, I'm going to show you two models of this project. The first one is what we are building toward long-term. And then I'm going to show you a second model, which is going to be the first phase, sort of a stepping stone to this optimal model. So basically, when an officer is making an arrest, they are going to make a decision about charging someone with a felony or a misdemeanor. If someone's being charged with a felony, the officer will take them to jail, just as usual. They'll be booked in, as is currently happening. If they're being charged only with a misdemeanor or misdemeanors, they're going to be taken to this new facility. So the new facility is going to handle all misdemeanor admissions. There will be an exchange of custody, very similar to what happens at the jail already, with a medical screening, pat down, et cetera. And then there'll be a booking process that happens, again, with photographs taken and fingerprints taken. And then from there, we'll have a first appearance component. So the individual will meet with pretrial services to have their indigency screening completed, their risk assessment, and their interview prior to their first appearance hearing. And then there'll be a first appearance hearing held where a judicial officer will determine whether they're going to release that individual pending trial or whether they're going to set bail. If bail is set, that individual will be taken, escorted to the jail. In all other cases, they'll get their property back and they'll be released. This first appearance component is very exciting because I'm not sure if you all know, but typically 7:30 a.m. is the cutoff for first appearance. Sometimes it goes up to about 11:30 a.m. But let's say someone's arrested at 1 o'clock in the afternoon. They get booked into jail and they're held overnight to go to court the next day. And even if court the next day means they're just going to be OR'd back to the community. So by moving first appearances earlier in the process, we're going to avoid the cost of having to book someone into the jail, dress them down, feed them, and hold them overnight, and then also going to avoid all of those destabilizing impacts as well from a night spent in jail. The first appearance component, however, is also very complicated because it requires changes in operations,
from law enforcement, the courts, the public defender's office, the prosecutor's offices, et cetera. So it's a very heavy lift. It's taking a lot of planning. And as a result, we are moving forward with a sort of pared down first phase to the model, which I'm about to show you. But I just realized I want to highlight for you all that this model, if operating 24 hours a day, 7 days a week, would divert about half of jail admissions out of traditional booking and into the intake and releasing facility. The second model, as I mentioned, is pared down. So it would mostly start off the same. Misdemeanors go into the new facility. There's an exchange of custody. Someone's booked in. If they're being held on a domestic violence charge, DUI, or a warrant, they would be escorted to the jail. If they are held on a simple misdemeanor and qualify or are eligible for book and release, which is currently happening at the jail, it would happen out of this facility. But before they're released, they would have an opportunity to meet with a case manager. And that case manager would do a quick needs assessment and then help connect them to resources or services that individual would like. And then they would get their property back and be able to go back to the community. So this is going to be the first phase. If this was the only thing operating 7 days a week, 24 hours a day, it would impact or divert about 13% of jail admissions out of traditional booking. Because this is new, however, we're going to start small and then build up. So the initial pilot operating hours are going to be just Monday through Friday during the jail swing shift, which is 3:20 p.m. to 11:20 p.m. And then from there, we'll iron out some of the challenges and be able to expand it as long as it is proving promising or effective. And then I've mentioned some of the potential savings, but you can see them here. Again, reducing those overnight jail admissions, reducing recidivism, those repeated book and releases or repeated arrests by, again, connecting folks to services. And holding that first appearance hearing earlier is also going to drive down some of those FTA rates. And then, of course, the subsequent jail admissions for a failure to appear in court that results in a bench warrant. So where we are currently, this just gives you a high-level timeline of where we're at in the process. So sorry, this date should say October 5th. But we are in the process of conducting a site analysis on the county campus, going through the permitting procedures, getting mobile office units that are going to serve as the temporary, as the intake and releasing facility while we prove the concept. And then we should be ready to go with that phase one by December 21st. We are under this tight timeline in part because it's CARES funded, and so we need to expend the funds and have a project up and running before the end of the year. This is the current design of the facility. We are potentially tweaking it a little bit with the mobile office unit business that we're working with, but it gives you a sense that law enforcement will be able to come in here through the pat-down area, get booked in, folks will wait in an open booking area, and then ultimately when we have the first appearance component, they'll be meeting with pretrial services and then going into the video courtroom. Until that's established, that we'll have the case manager in one of these spaces. We have been working with Spokane Police Department. Captain Hendren's been working with us on this. And so far, it's my understanding that he's excited about it, especially because of those efficiencies that I've indicated or explained earlier. And so we'll continue to work with Spokane Police Department as well as the other law enforcement agencies and municipal court as we continue to develop the project. This box up top is the site for the intake and releasing facility. So if you're familiar with the county campus, you have the jail down at the bottom of your screen, the DEM, and then the intake and releasing facility. The mental health crisis stabilization facility that Mike Ormsby was talking about earlier is up in sort of this corner. There is going to be a secured and enclosed pathway where folks can be escorted from here into the jail. But we had to site it here for a lot of different sort of facilities logistics. And so that's the closest we can get to the jail, and then we can, again, have that secured pathway in case we need to escort someone. And then these, just to give you an understanding of what sort of office unit we'll be procuring, there's going to be 2 of these units that we get installed and retrofitted to match the design. So sort of one will be handling the intake process and the other will be handling the case management first appearance process. Some of the complexities with this project, which you've heard me mention throughout the presentation, is because it, again, changes operations or requires business changes across multiple different stakeholders. So that includes law enforcement changing the way that they fill out and file paperwork. And it also includes changes for prosecution in terms of how they receive that paperwork, build out a case, and make that information available to the courts and the public defenders. It also implicates some challenges with staffing. So we'll be working with unions and already different department heads and elected officials are starting those conversations. There's a question about capacity with staff, sort of how much more staff would be required to set up this and sustain this model. And we're also exploring whether there's any opportunities to collaboratively staff the project. So for instance, can a single judicial officer handle the cases from both municipal and district courts, for instance? And that comes with its own set of challenges and requirements that we're addressing, but it can also result in increased efficiencies by sort of sharing the costs across the city and county. So that's not decided, but we are exploring that as an option. And then, of course, securing sustainable funding beyond the end of the year, which is funded by the CARES dollars. So we're continuing to collect information at the administration's request and sort of sharing updates to them and then getting clarity in terms of what the city's interest and involvement will be moving forward, having lots of meetings with municipal court and the city public defenders and prosecutors' offices to help inform our plans and sort of what the potential budget and staffing models could look like. Continuing to develop those first appearance requirements and procedures. And then finally, we're very close to getting those mobile units retrofitted and then installed on the county campus. So that was a lot of information that I shared with you in a very brief amount of time that covers a lot of weeks of work, but happy to answer questions or try and take back, get back additional information to you.
Are there any questions for Maggie on this topic? Councilmember Stratton.
Just a quick one. So the people coming through this facility either go to district or superior court. Is there ever, would any of those ever go to district or to community courts, or is that's completely separate from this?
So the individuals eligible for this would be either in municipal court or district court. And sometimes folks in community court may be rearrested while they're out, and so they may come through this facility and be processed that way.
Councilmember Stratton.
But there would be, either way, there would be a connection to community court if you need it, correct?
We haven't met with community court to figure out any specific procedures for community court clients, but that's something we can add to our list and reach out to Seth and Judge Logan to discuss further.
Perfect, thanks.
Yes.
Maggie, is this for anybody who is arrested on a misdemeanor?
That would be, that sort of goes back to our long-term goal. Ideally, we would like to handle all misdemeanors in this facility, and so we're trying to vet whether that's possible to start off with or if we'll start with a smaller population.
And so what criteria is it that that I guess they would have to meet to be released?
That's up to the decision of the judicial officer. And so what would happen, just like any first appearance, it would just happen in that facility. So establishing probable cause and then weighing factors to determine what the most appropriate decision is for release.
And would they be going before an actual judge or some sort of a court commissioner?
It really depends on the court, how that's handled. In district court, Judge Smith currently handles the first appearance docket. I'm not sure if we still have Judge Staub or Judge Logan to speak to how municipal court's currently staffing those hearings.
Yeah, I don't see them. And I can find out. My last question, you made a comment about right now that folks who come in the afternoon have to stay all night, but I hear all the time about folks who are, regardless of the time of day, they're brought in and they're released almost immediately. So how are some released immediately, but others have to stay overnight?
There's a general court order, both municipal court and district court has it, that delineates certain charges that the jail can book and release. So those are those individuals you're hearing about. Ideally, we would like to have the first appearance, even for that population, because by having the first appearance earlier on, you reduce the FTAs in the future because it's one less court appearance they have to come back for. But then also, if we start out with just booking and releasing, as we currently are, we would have that new component of the opportunity to meet with a case manager. So yes, they would still be booked and released, but potentially connected to some supportive services or resources.
Okay. And my last question, just how long, ideally, how long would that whole process take from when they're brought to the facility to potentially when they would be released?
It really depends on whether we're including the first appearances in that or not. For patrol officers, I think on a good day, it takes about 15 minutes or so to get in and out. And so we would want to at least be there and then ideally reduce that time for patrol officers coming in and out of the facility.
Okay. All right. Any other questions? Council President.
Yeah. Maggie, if I understand it, the district court and the sheriff's office is going to fully utilize this, but we need more commitment from city administration to use it, just because they're going to have to change their staffing a little bit to do it. And so that's under negotiation, I think. And I think the prosecutor's office has told me they need some more resources in order to pay their staff for those swing shifts, or at least work something out that way. Is that kind of the status? Or?
So I think with that phase one model that I shared, sort of the simplified form of this project, that could be utilized by all law enforcement agencies, both city and county. What we're still working on is that first appearance component. So if we're going to involve the city public defenders, prosecutors, and municipal court, that's going to take some additional planning and budget modeling.
Very good. Okay, seeing no other questions, we will move on to our next point. Thank you very much, Maggie.
Thank you.
We've got Council President Beggs, looks like, for an update on foot and bicycle patrols downtown.
Yes, and I think Councilmember Kinnear arranged, but Captain Singley from the downtown precinct is just going to give us an update on that, I believe.
Great. Captain Singley?
Hello. Yes, I'm here. Can you hear me?
We got you.
Oh, good. Yeah, Dave Singley. I'm the downtown precinct captain, so I'll be short and sweet. We are doing foot and bike patrols currently. We have them daily for the most part. It is somewhat staffing dependent. We currently have 3 to 5 officers working on any given day. They're doing a variety of other tasks. So most days we're able to do the patrols, but some days we don't if they're getting pulled away. Foot patrols, we tend to focus on more of our crime hotspots that we've identified, and we put officers into those areas. While the bike patrols, we tend to have in just the larger downtown area, just as more of a presence. And going forward, we're hopeful that with the new officers in 2021 that we'll able to have a more scheduled, regimented, daily foot or bike patrol presence. Any questions?
Questions from anybody? Captain Singley, how will winter weather affect the patrols outdoors?
Well, we won't have bike patrols typically in the winter, but we will still have our officers out on foot. They'll just transition to the foot patrols.
Okay. Perfect. All right. Anything else?
I've just
seen Council President.
Yeah, Captain Singley. I know from hearing from downtown property owners, I think one of the most urgent things for them is foot patrols, checking to see if people are sleeping in doorways and entryways and things like that. So are any of the patrols, as you get more staffed, are they going to be targeted periodically through the evening for that type of vigilance?
Yes, and that's one of the things that we do now, particularly with our foot patrols. And one of the main areas that we're seeing those issues is in the viaducts. So one of the main ways we've tried to address that is we meet, right now we're meeting 3 days a week with the city's litter crew and Geiger and the ambassadors with the DSP, and we jointly go through and hit Brown Street, Madison, and we've recently added Wall and Post as well. So yes, we're doing those things now, and yes, as we get more officers, we're hopeful to be able to do even more of that.
And just since I have you, it's not related to foot patrols, but I know every night you get a report on whether there are low barrier shelter beds available or not. I'm just curious as to what the last week or so, have they been all full? Have they been available to men? What's the status out there?
That information is put into our SharePoint software every night by the various providers, and I have not seen the last week's report, so I don't know what we've been out on a nightly basis. But that's what our officers use if they are going to, in fact, cite people for those types of violations.
Thank you.
Okay, thank you very much, Captain Stingley.
Thank you.
No other questions. We will move on to our last agenda item here, and we'll turn it over to Council President Beggs to lead a discussion on budget items related to public safety.
Yeah, so we scheduled just on all committees a chance to talk over specific issues informally. I believe the administration is going to release a preliminary budget today, if they haven't already done it. Anyway, there's a list of things that we could go over, but I'm just checking in. I don't know if people want to spend the time to talk about those tonight or not, so I don't know if they're nodding yes or saying no, we can talk about it later. I just kind of put it on as a placeholder, so I don't want to drag people through it if they're not interested, but if people want to talk about some of the things, happy to go through the list. So, curious as to what my fellow council members are interested in.
Council President, I included on there, which I know is not likely to happen in our current budget situation, but the pursuit, my continued pursuit for a pilot of neighborhood policing, similar to we're seeing downtown, but to do it within our neighborhoods and business centers.
Yep, and I have that on the list. Boy, there's public safety and community health has the most suggestions from people. It includes utility tax credit for shelters. It includes several increased grants to agencies that have been providing us community health services. It includes more behavioral health specialists to go with patrol officers. It includes more money for code enforcement officers. It includes, not sure if it's really in this division or not, but establishing that City Office of Civil Rights that we keep putting in the budget every year, but doesn't get hired for. I don't know. Those are some of the highlights, but again, just wanted to create space if anyone on council wanted to talk about public safety or community health budget priorities. The idea is after we get the administration's preliminary budget, we will get some analysis from our budget officer, Tim Donovan, and then we will go through the process of discussing, debating, and approving a resolution on any changes that a majority of council wants to make for the final. So we'll be doing that the month of October is the process. Yep.
Council President?
Yes.
Wilkerson here. Just want to put back out there again this year, with our equity initiatives, we had been talking about looking at our budget through an equity lens. I think we have been challenged on the administration side and council side because there has been no consistent training for folks to know exactly what that looks like. And the community is concerned that because the budget is short, that will be an opt-out for the investments that we have been looking for and that has been promised to the community around this whole equity initiative.
Yep. I think that's a great point. We hired...
Council President Beggs. Oh, sorry.
I was just going to say, I share your exact concern. In terms of training around equity and diversity and anti-racism and anti-white supremacy in the police department, we do have funds in our public safety levy for that available. In terms of council, I've asked Alex, who's our new manager of equity issues, to make a recommendation to us on training internally to council and council staff. And we'll be talking about that at our upcoming council retreat later this month. But I agree, when we get to the budget conversation, that's going to be probably a priority for a lot of council members. So I totally appreciate it. And that's where we'll address it internally for us as a department at our retreat and get some guidance from you all on how to move forward. And then in terms of the whole budget in that resolution process, that's right where that's going to be. So, Councilmember Mumm.
Sure. On the council side, we each have training dollars or some funds within our own accounts that maybe we could take a look at. Several of us on council did have that kind of training, but we've had enough new people come on. Certainly always time for more of that. But I want to mention that the council has invested in that in the past. And also, the community assembly was promised $4,000 for training this year. And I want to make sure that's preserved and offered to them as well. That might be a great suggestion for how that might be used because they won't be able to travel this year. So I will put that on the finance agenda to make sure that that community assembly training money is preserved, unless I know we have some emails flying. Did we find out? We know it's there, but we need to make sure it's in their hands to allocate. Is that where we stand on that?
Yeah, I asked the leadership to let us know if there's any specific training that they think they could accomplish before year end, if they want to do it. And if not, then we would seek to put it in, I think once a year we have either, it's probably a special budget ordinance, but under encumbrances that allows us to take money in one year and push it into the next calendar year. And there's all sorts of things that get into that. So we just need to make sure that that's added into that.
And I would hope that it's the kind of training that could also be afforded to the neighborhood councils as well. Mm-hmm. Thank you.
Councilmember Wilkerson.
Thank you, Council President Beggs. I just want to again shout out to the administration. They have been a great partner with us on council side. And again, as they go through this budgeting process, that they avail themselves of whatever equity lens training that's available to them so that we can truly work in partnership.
Great. All right. I don't see any more questions for me on this topic. Councilmember Cathcart, I'll turn it back over to you.
Perfect. Well, we don't have anything else on the agenda. Is there anything for the good of the order? I am seeing and hearing nothing. So we will adjourn this committee meeting and see everybody back at 3:30.